It's something that is the hardening of the arteries so that the blood there's difficulty for the blood passing. That leads to things like high blood pressure and things like that. Coronary heart disease. Coronary heart disease, now, our circulatory system is made up in such a way when the heart, pumps blood out of the ventricles to go to the rest of the body, some of that blood goes to the heart muscle of itself. All right? The artery that supplies the heart muscle of itself is what is known as the coronary artery. And there in that artery also, when it is diseased, we call it coronary artery disease. And this would lead to things like heart attack, heart failure, and things like that. Stroke. Stroke is another one of the cardiovascular diseases. All right? And you would agree with me that these are things that we find people coming up every day. Every day. People would come with some high blood pressure and they're like, oh, that is normal, man. You know, it cannot be. That's not how we were made. All right? Next. Angina pectoris. Angina pectoris is basically the precursor to a heart attack. It's when the same blood vessel that supplies the heart is starting to get blocked up, that the blood is having some difficulty passing to get to the muscle of the heart. And so we start getting some pains and so in our chest. Arrhythmia. Arrhythmia is when the electrical activity of the heart that triggers the pumping action of the heart it gets out of whack, and so the heart starts to beating in all kind of irregular rhythms. All right, and so we have arrhythmia. Congestive heart failure. This is one of the conditions that can result from these high blood pressures that we're walking around with, thinking everything is okay. All right? After a while, the hearts get tired of pumping the blood at such a high rate, and so it starts to fail. All right? So we think that it's okay. We don't feel sick. All right? And so the heart starts to fail. The heart starts to give in, starts to give up. You can't be pumping all of this blood at this pace all this time, and we get a heart failure. And then the last one is congenital cardiovascular defects. This is the only one that really we may have no control of. Maybe our parents might have some control. All right, this is where children can be born with heart problems, heart murmurs, and a case like that. So we say that these are the main cardiovascular diseases that affect our world today. All right, and they play a great role in our ability to function effectively. So this slide gives us, all right, thanks. All right, good. All right. So this slide gives us a picture of our heart, and the two pictures at the side is our blood vessels. The one at the top talks about, is giving you an example of what a normal blood vessel should look like. Nice, clean, and clear. But the one at the bottom is talking about what happens when there is atherosclerosis. What is basically happening is plaque starts to form within the blood vessel, and they start to build house, set up mansions in, in your blood vessel. All right? And the bigger that mansion become, the worse it is for you. All right? And there are a number of things that can cause those mansions to be set up, which we will look at shortly. I went. Oh, where did I go? Oh, no. I'm going the wrong way. All right, I'm going right now. Okay. Again, these are some common heart attacks, signs and symptoms. And again, as I say, we keep walking around with high blood pressure, high cholesterol, high triglycerides, and we don't feel anything significant happening with us, and so we believe that it's okay. But the damage that is being done in our bodies is slow and progressive. Slow and progressive. These are some signs that we may feel. A lot of times we just pass it over as maybe some indigestion or something like that. So the first one there, crushing, squeezing, chest pain. All right? And this is something that men would experience for a heart attack. Pain radiating down the arm, neck, or jaw. Again, men would experience that. Any arm. But generally, it would be the left arm, but any arm. Any arm, all right? Women are more likely to experience this. Chest discomfort or pressure with shortness of breath, nausea, vomiting, or lightheadedness. That is something that women would feel basically routinely sometimes, but that can also be a sign of heart attack occurring. All right, so you just feel nauseated, you feel like you want to vomit. All right, you want to feel a little lightheadedness. You might say, oh, must be my pressure low. All right, that can be a sign of a heart attack. Shortness of breath without chest pains. No chest pains, you just get the shortness of breath. All right, discomfort in the back, neck, jaw, or in one or both arms. A sign of heart attack in women. Unusual weakness. Sign of heart attack. Unusual fatigue. All right? Sleep disturbances. All of these, I'm saying, are signs of heart attack. And this is in women. All right? Women experience it different to how men experience it. All right? Indigestion, flu-like symptoms. All of these are signs and symptoms that women experience that can be signs of heart attack. And so the bottom line I'm saying is that as we're going to get down to some of the things that we do with ourselves is what will lead to the cardiovascular diseases. And we may feel, we will get that assumption or feeling as if, oh, everything is okay with us until we get a big knockdown. All right? And then we say, oh my, I didn't know. All right? All right, so these are some of the ways in which our blood vessels can be affected that can lead to a stroke. So the first picture there is where there is a clot, what we call a thrombus. It's just stuck there in the blood vessel and preventing blood from getting to anywhere beyond where that clot is. All right? That, when it occurs in the brain, would starve the brain of the necessary nutrients and oxygen that it needs and can lead to a stroke. All right? There's an embolus that does something similar to the thrombus. It's a clot, but this clot now is one that is moving around the body. All right? And again, wherever that clot gets stuck, that's where we have the deprivation of oxygen and nutrients and can lead to a stroke. Then there is the other situation where bleeding occurs in the brain as a result of a blood vessel being broken or burst. All right? Again, no, not the aneurysm. The hemorrhage. Not the aneurysm yet. The hemorrhage occurring, and a lot of times because of the high blood pressure, the pressure at which blood is flowing through these blood vessels can lead to breakage in the lining of the wall and leading to bleeding. And the last one there is aneurysm, where the blood vessel again, the walls of the blood vessel get so weak that they begin to protrude and form like a balloon. All right? And when that balloon bursts, we have bleeding occurring, leading, well, when it occurs in the head, in the brain, sorry, we have a stroke occurring. All right, so these are some of the things that happen with when we have a stroke. This slide looks at a simple test for a stroke. All right, you want to know if somebody is having a stroke. We use the acronym FAST. F meaning facial droop or numbness. So you see the one side of the face starts to droop. All right? Or if you try to touch that side that is drooping, they don't actually feel it. They're not feeling you're touching it. All right? A, arm weakness or numbness. So any weakness in the arm, all right, or numb feeling in the arm, and that is one side of the arm, one arm. That would be a sign of stroke. Speech difficulty. You ask them to say something and you find that they're stuttering and the voice sounds slurred or the words are slurred. That is a sign of stroke. And the T is time to act. When you see any of those occurring, or maybe all of those occurring, you need to get this person to the hospital as quickly as possible. All right, so that something can be done to fix the problem. Oh? You want it? Oh, there you go, come on. Oh, wrong way. Wrong way. Where did I go? So let's talk now about reducing our risk. All right, we talk a lot about what cardiovascular disease is. What can we do to reduce our risk? The greatest contributor to cardiovascular disease is suboptimal diet. The first thing to talk about there is our diet. And the Bible, when God created man, He gave them the diet. Genesis 1:29. All right? Of the herb, eat of every herb, of every fruit. All right? The greens. All right? Those are the things that God gave us to eat. Followed by tobacco smoking. Well, I hope that nobody here falls in that category. All right? High body mass index. We're talking about being overweight now. Obese. All right? High blood pressure. So you might not be overweight, And I have a lot of my patients that are not overweight, but the blood pressure is high. Why? Because of the cholesterol. All right, those same blood vessels, as I spoke of earlier, the plaque starts to build up and build mansions in your blood vessels. Here we having these mansions being built in our blood vessels, and the blood pressure, it's harder for the blood to pass, and that increases our blood pressure. All right? High fasting blood glucose. All right? We're going to talk more about that this after in the next session, where the blood sugar is higher than it is supposed to be, and the physical activity. So these are some of the things that contribute to cardiovascular diseases. A combination of these factors and others appear to also increase risk for insulin resistance and type 2 diabetes, which we will talk about later. These combined risks are called cardiometabolic risks. So when we're not eating as we should, when we're not exercising as we should, when we're not controlling our weight as it should be, all right, when we're not ensuring that our blood pressure is kept under control, we are increasing our risk for cardiac diseases or cardiovascular diseases. Now, I told you earlier that we're going to talk about what metabolic syndrome is. We say metabolic syndrome. Whenever we hear syndrome, syndrome is a combination of things occurring at one time. Like acquired immune deficiency syndrome, all right? AIDS is a number of diseases taking control of your body because it is not able to fight off these diseases. Now, metabolic syndrome is similar. A number of these conditions coming together to affect our bodies. So the first sign of metabolic syndrome is a big belly. A pouch. All right? So if your waist is, in men, is over 40 inches, in women, it's over 35 inches. All right? You're having the first sign of metabolic diseases. Yeah, right or wrong. When you take the tape measure, measure right or wrong. All right? And it is. Yeah. All right. Now you may go to the doctor and the doctor may order blood tests for you. It's nice to look at those results and see what is happening with you. All right, so one of the tests that they can order is triglycerides test. This is one of the fats in our body. For the matter, this is the most abundant fat in our body. You hear a lot about cholesterol, but cholesterol is only a very small portion of fat. Of course, it does a lot of damage when it is too much, but triglycerides is the fat that is most abundant in our bodies. When we take a blood test and the triglycerides in our blood is more than 150 milligrams per deciliter, that again is an indication of one of the signs of metabolic syndrome. Now, cholesterol. We hear about good cholesterol and bad cholesterol, isn't that so? Yeah. All right. Now, really and truly, both cholesterol is good. Both the good and the bad is good. In that, the bad, yes, it's about the balance. the bad cholesterol, the one that we call bad cholesterol or low density lipoprotein, they have a work to do in helping to absorb the fats and protecting the lining of our blood vessels. However, what tends to happen is that it goes out there and sits down and starts to build up the mansions that I spoke of earlier. The good cholesterol, the role of the good cholesterol is to remove that bad cholesterol after it will have done the work that it's supposed to do. The problem that we have is that we have too much of the bad cholesterol that is going there to do its work, but it has none or very little of the ones to remove it. All right? So, if our good cholesterol or high density lipoproteins is less than 40 in men or less than 50 in women, it's another sign that we are going into the state of metabolic syndrome. All right, so far we looked at abdominal waist, we looked at triglycerides, and we looked at high density lipoprotein. Another one of the things that make up the syndrome, metabolic syndrome, is high blood pressure. Your blood pressure is over 135, 85, over 85. Again, we're building up our case for having metabolic syndrome. We check our blood sugar in the morning before eating, and it is over 100. That is another sign. Another blood test known as the C-reactive protein, if it's greater than 10, again, it's another sign. So these are the things that make up metabolic syndrome. And you find that people would have all of these here. All right? Some would have some. All right? But the thing is for you to understand that, okay, if any of these things are occurring with me, I have some work to do to keep it under control, to get it back to where it's supposed to be. So if you know that you have a large waist, we have some work to do. If you know that if you went to the doctor, they check your blood, your triglycerides is high, we have some work to do. If your high density lipoprotein, the good cholesterol is low, we have some work to do. Blood pressure is high, we have some work to do. Our blood sugar is high, we have some work to do. All right? And so these are some of the things that make up metabolic syndrome. I want to also underscore here that we can have all of these things and still be feeling good and healthy. Yeah. So it gives us that false assurance that, well, yes, I'm good and healthy, I'm strong. All right? But really and truly, we're setting up ourselves for Mount Hope. Mount Hopeless. Yeah. And so I want to emphasize here the need for checking yourself. Prevention. Check yourself. Keep monitoring what's going on within your body. Don't wait till you can't do anything. You fall down and drop down on the road before you check. All right? Some other risk factors. All right, we talk about inflammation and C-reactive protein shortly. And this is what happens with this condition. Inflammation occurs when tissues are injured by bacteria, trauma, toxins, or heat. Now, remember, let's go back to where I mentioned before about these plaque making formation, making buildings, setting up mansions in our blood vessels. We talk a little bit about it in when we talk about the bad cholesterol. All right, so that is one way that mansions can be set up in our blood vessels. So the food that we eat, all right, a lot of the saturated fats, the KFC, yeah, Pizza Hut, yeah, the snacks that we buy for our children, right? I don't even remember them now. All those different snacks, whatever they be, all right? Those things are high in saturated fats, and they would contribute to setting up those mansions in our blood vessels, bad cholesterol. Then there are times when we get sick, when we get sick from some form of a bacteria, all right? Again, those bacteria tend to injure the linings, the walls of our blood vessels. And that injury would lead to an inflammation, and that inflammation would lead to plaque formation and the development of these mansions we're talking about building up in our body. All right? So bacteria, trauma, all right? We get into accidents and so, toxins, all right? Again, a lot of the things that we eat are toxic to our body, all right? It's not what God originally intended for us to eat or heat. So these are the things that form the plaque formation to help with the blocking up of our blood vessels. Risk factors such as cigarette smoking, high blood pressure, high levels of low-density lipoprotein, the bad cholesterol, diabetes, and certain forms of arthritis have been linked to an increase of this C-protein, C-reactive protein in our body. All right, so here again we're seeing that some of these same cardiovascular diseases, some habits that we may have, is what would lead to that occurring. Greatest risks appear to be linked to infectious pathogens when we are infected with various kinds of pathogens. So this slide gives a pictorial view of metabolic syndrome. We talk about metabolic syndrome. So elevated triglycerides, reduced good cholesterol, elevated fasting blood sugar, elevated blood pressure, and large waist circumference is what make up our metabolic syndrome. So what can we, these are some risks, and at the same time we talk about what we can do. So now, there are risk factors that will make us more susceptible to cardiovascular diseases. Some of them we have control over, others we don't have. First, we'll talk about those that we have control over, the modifiable risk factors. Avoid tobacco smoke, and I'm hoping that I can just pass this over. All right? Huh? Oh yes, my wife just reminded me that we may not be smoking, but secondhand smoke is even worse than smoking. All right, so we got to be careful of that. Yeah. Next one is that we want to cut back on our saturated fat and cholesterol. And I started identifying some of those earlier. All right, these fast foods. People don't want to cook today. And the thing is, if I have a business, all right, and I want you to come and support my business, I'm going to make whatever I am offering to you appealing to you. Isn't that so? And that's all that the fast food people do. They make sure that the food tastes nice and smell nice. And how you think they get that done? By putting in the things that your body should not have. All right? And so you go and buy it and say, oh, wow, food tastes nice, man. I got to come back tomorrow. All right? And all we're doing is injuring our body, shortening our lives. All right? Strive for a heart-healthy diet. All right? When I reached here, then I realized that I didn't walk with that video that I was supposed to have. I would have shown a video that looked at what make up a heart-healthy diet, the Mediterranean diet. But I left it home. All right? But we want to strive for a heart-healthy diet. You want to use more of the unsaturated fats, which would include the oils that come from the plants, like the olive oil, the canola oil, safflower oil, all right? And grapeseed oil, yes. The oils that come from the plants, the avocado, yeah. Yeah, coconut oil as well, yeah. There's some controversy over the coconut oil, though, but I still believe that the coconut oil is good. All right? All right? And so we want to focus more on the foods that are heart healthy. And by the way, these oils that we just mentioned, they become saturated when we heat it. All right? So when we cook with it, we don't benefit from it. All right? The nuts is another form of getting heart healthy fats, right? The peanuts, the almond nuts. All right? These nuts give us the right kind of fat that our body would need. You want to maintain a healthy weight. All right? And how we do that again is something that we may need to talk one-on-one about. Because what would work for one person may not necessarily be what works for somebody else. All right? And so let's talk. We need to talk about what is happening with you. We need to talk about how we can come up with a plan that is suitable for your specific circumstances. But generally speaking, to maintain a healthy weight, we want to keep our bodies active for at least half an hour a day, 5 days a week. All right? And so we want to maintain a healthy weight. So we exercise regularly. If we have diabetes, we want to have it controlled. Oh my, that's another thing. We have people walking around with blood sugars 300 and 400, and oh, it's low there, man. It comes down a little bit. You hear things like that. I'm like, what? All right? That's not supposed to happen. It's not supposed to happen. And we need to have it controlled. All right, but we're going to talk about diabetes in the next session. Control your blood pressure. All right, that is another one. You know, people walking around with some blood pressure over 200 and those things, and you know, the thing is, you hear that the blood pressure is a silent killer. You hear that? Yes, and it is. It is. I have seen people walking around with high blood pressure and they're saying that they're okay. You know, but it is not okay. It is not okay. We need to have it controlled. So again, this is something that we need to talk about so that we can come up with a plan that is suitable for your situation. All right. Again, when I come across my patients that, well, I only recently started working there, about 5 months now, and I try to take the time out to, for those that would come to me, try to take the time out to talk with them, helping them to understand that we got to do something about this blood pressure. We got to do something about this high blood sugar. All right? And it is not only about medication. Because a lot of people say, oh, I take my medication every day. Yeah. But what else are you doing? We need to understand that this is our body that God has given to us. And God gave us a mandate to take care of it. All right, our bodies are the temple of God, and we need to care it. We need to treat it as if it's the temple of God. All right. You want to manage stress. Huh. We'll talk a little bit more about that when we look at diabetes as well. But stress is a major contributor to some of our cardiovascular diseases. And basically it's about us understanding how to handle stress. But the Bible says in Isaiah 1:18, Jesus says, come, let us reason together. So your sin be as scarlet. So you may have all the worries in the world. Come, let us reason. Let us talk with God about what's happening in my life. Stop taking it on yourself and put it to Jesus. Now, stress can be looked at from two perspectives. By the way, when you hear stress, what do you think about? Huh? Like what? Worries, frustration. All right. So those are the things that pressure, right? Plenty pressure. All right. So that is one form of stress. Another form of stress is the internal stress, like when you're sick. You have withdrawn. That would be more external. But like if you have a fever, for example, the temperature of your body is higher than normal. That the body has to fix, and that is a stress on the body. You get the flu, all right? That is stress on your body. So if we have persons with diabetes in here, it's important for you to understand. Well, diabetes is my pet area, right? It's important for you to understand that when these things are happening, you get the flu, you get a fever. It is a form of stress, and it can cause your blood pressure to go up. It can cause your blood sugar to go up. And so this is a point in which you need to take extra special effort in helping to control your blood sugar and controlling your blood pressure. All right? stress. Now, these are some of the risk factors that we have no control over. Let's look at them. Race and ethnicity. Remember I said earlier that African Americans are most prone to developing cardiovascular diseases. So, do we have a choice in that? Can we say, oh, this woman here is African American, so I'm not going to be her child? Can we say that? No. So we have no control over that. All right? Heredity. All right? Again, genes passed down from great-grandfather to grandfather, and from grandfather to mother, and mother to you. These things are, but we have no control over that. All right? Gender. Again, earlier I spoke of cardiovascular disease affecting more men than women. So can we peep out and say, oh, it's getting that, so I want to be a woman? Can we? Can we say that? No, we can't say that. We have no control over that. Although some of them trying, they're trying to do that. The wicked people. All right, age. All right. As we get older, our chances, our risk for cardiovascular diseases increase. So can we say, all right, I'm 20 years today. I'm going to stay at 20 for the rest of my life because I don't want to get older. We have no control over that. All right? All right. The thing though is that, so we're saying that we know that these are risk factors. All right? We know that as we grow older, we become more at risk. It means therefore that we need to take the necessary precautions. Do the things that we could do. We talked about the modifiable risk just now. All right? Do the things that we can do so that we can minimize our risk in the other areas. All right. You can make that bigger. Yeah, like how you did the other one before. This is a slide that looks at our, again, as I mentioned before, it's good for us to look at those numbers, at those blood tests that the doctor would order for us. It's not only for the doctor, it's your thing, you know, it's your health. So you need to be aware of what's happening with you. All right? So, these are some numbers that we want to be all right? Total cholesterol. We want to aim for, look at it, all right, 200. Then cholesterol is broken down into HDL and LDL. HDL is what we call the good cholesterol, 60 and above. It's supposed to do. Then the LDL, the bad cholesterol, we want it to be less. Those are what make up our cholesterol, all right, our less cholesterol count. Then we have the triglycerides, all right, which I said before, over 150 is what contributes to metabolic syndrome. All right? Help in reducing or minimizing. I have the pointer. All right. All right, we're going to have to move, we're going to have to skip these two slides because these slides were in relation to the video that I was supposed to show you. These are some tests that are done to diagnose and treat. Basically, you're making new blood vessels, all right, to allow the blood to get some oxygen and nutrient. The heart, sorry, to get some oxygen and nutrient, the heart muscle, all right. But the thing is, after these surgeries, we go back to the same lifestyle. So what do you think will happen? Those same ones gonna block up again. So we don't learn. We don't learn our lesson. Then there are, well, so the angioplasty is when they actually make a blood vessel to do that, and the stents, all right? The stents is actually like opening, keeping the blood. It's something that they put in the blood vessel that is there already to keep it open to allow some blood to pass. Then there's some aspirin that can be given. Generally, sometimes the doctor may say, take an aspirin a day to help to thin the blood. But if we eat right and we exercise, we don't need to have to thin the blood. All right? Now, let's look at cardiac rehabilitation. Every year, more than 1 million people survive heart attack. Wow. More than. 1 million. No, the thing is though, dying might be a good in a sense, because you don't have to worry anymore. But a lot of these people have the heart attack, and there's so much a liability to society after that. You know, they have the heart attack, they can't work, they have to be dependent on people, you know. And so we're saying that we want to avoid this from happening. Yes, dying is bad. Yeah. But why be alive and you really can't enjoy life? You know? And so we're saying that over 1 million people every year surviving heart attack. So cardiac rehabilitation exercise training increases stamina and strength and promotes recovery. So we're saying that exercise helps with this here. Dress it on. He didn't say, oh, Adam and Eve, I made a lovely garden here for you. You just rest and enjoy yourself. Is that what he said? Why do you think he said dress it and keep it? He said work. That is work. You need to be active. You need to keep it. Ensure that this garden remains as it is. You have work to do. All right? And so I'm saying, if you have a cardiovascular disease already, that should not prevent you from exercising. All right? You hear people say, oh, I have arthritis and my foot this, and so I can't exercise. No, 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 no. No, no, no. Exercise don't have to be walking. So if you can't walk, you still can exercise. Hear people say, oh, I had back surgery, so I can't exercise. No, 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 no. Exercise don't have to be bending your back. But again, we're saying that, come let's talk, so we can work out something that is suitable for your specific situation. Since we still have much to learn about cardiovascular disease and its causes, treatment, and risk factor, staying healthy means staying informed. Do what you can do to remain healthy. Some saturated fat in our diet, we may say that, oh, no, you will not be getting the goat fat. Want to really get, yeah, I see.
I understand that the grapeseed oil is used for text.